Now's the time to finally realize we the people must make some choices. If we want single-payer health care, now's the time to raise our voices till they hear us in the halls of Congress and behind the White House door that we're sick and tired of getting sold out and won't take it anymore.
I'm Sherry Weinberg, formerly known as Sarah Weinberg, but Sherry's been my nickname lifelong. And I'm the president of this here Washington chapter of Physicians for National Health Program. And I want to welcome all of you to our monthly meeting. And we have a wonderful speaker in Chuck Pennacchio. I will do the land acknowledgement. I live on Mercer Island, which is an island in Lake Washington, east of Seattle. And before white people settled in here, there were two Snoqualmie villages on Mercer Island. All traces of those villages are gone. But it's interesting because in general, people think of the Seattle as being the coast Salish, which is certainly true of all the towns around Puget Sound. But when you think about it, there was no tunnel through Mount Baker at the time. And Mercer Island and Lake Washington were quite a distance in terms of how to travel from Seattle. And the Snoqualmie tribe is more associated with the inland empire of tribes. We acknowledge that we're on the territory that was once theirs.
So announcements, really great news. Pramila Jayapal, our wonderful legislator from our district here in Western Washington, mostly Seattle area, is going to be the keynote speaker at the PNHP annual meeting in Chicago. And that'll be after the election. And I think the whole focus of that PNHP meeting is going to be, let's look at what happened to the House and Senate and the presidency, and then chart a way forward towards, universal health care, improved Medicare for all after that election. So it's really going to be a great meeting. And we've got 10 people from Washington that I know of that are going there, including 6 or 8 SNAP students. Last year, we had by far the most number of students. Luckily, we have some funds for them from the George Martin Student Scholarship Fund that has been helping us support them with their transportation and registration and living situation there. We had a single-payer healthcare summit a little over a month ago. I think it's been reported on before, but we had 20 organizations in the Washington area that support single payer come together for almost a full day conference to figure out how we could work together. That was really good to see people that you knew or heard of and made new friends and comrades there. So that was really nice. And that was followed up September 30th event. PNHP National was asking chapters that could do it to do something on September 30th as a campaign against Medicare Advantage. 7 or 8 chapters did something, but only 2 or 3 of them had something out in the streets, and we were one of them. We had a die-in where we had microphone banners and a corpse under a sheet, supposedly, and had actually more than 30 people show up. So here's what happened. This was at the outside of the federal office building. So we had a big thing. We were here for a couple hours, and we had at least 10 people speaking, including a couple of passersby. 30 people that I counted at one time, and I think a few other people came and went. So we had over 30 people there. It was a nice event. And once again, this is a follow-up from the summit. Our idea was the 20 organizations that were at the summit would coalesce and work together in the future on single payer for Washington state and federal. I think there were 40 people there representing 20 organizations, and they all agree that single payer is the way to go, and both at the state and national level. So I think this is going to kick us forward here. There's some fairly big organizations that were there, like Whole Washington. They've got lots of good organizers across the state, actually, and We got Physicians First, Social Responsibility was there, and Washington Community Action Network, which has great organizers across the state, and Puget Sound Advocates for Retirement Action. So we had all the players here that we've known each other, but now we're going to work a little more closely. So that's what that was about. So in the report from the meeting tonight, usually I edit the video and try to add a few things about what happened at the meeting and then blast it out in a couple, 2 or 3 days. There's a couple other announcements that PNHP National wants us to work on a project against Project 2025. I think we're pretty all aware of that. The thing from the Heritage Foundation that is put together by mostly Trump people, but he disavows it now because it's got such a bad name. But anyway, in that project, people would be enrolled automatically into Medicare Advantage once they turned 65. PNHP wants us to send letters to our legislators, and there'll be some links in what I send out about how to do that. Another is the link to the moral injury survey, which I think many of us may have completed already, but we'd like to get more people. PNHP National wants more people to complete that survey. That's the one where you talk about how pressure from Medicare Advantage or profit organizations put on you as a provider and also on your patients and leads to early burnout and a whole lot of extra work. And so anyway, and also a meeting on October 26th that's really geared towards people who are going to Chicago at 6 p.m. I'll have a link to that. And it's going to be talking about the workshops that will be taking place in Chicago. And for those going, there'll be discussion about how to get the most out of those workshops. Dana?
We now have 15 participants. Introduce ourselves.
David McClanahan, coordinator of PNHP Washington.
Sherry Weinberg, the president.
Dana Iorio, I'm the vice president. I've been with the organization since the outset in 2006. Been a member of PNHP National since 1989.
Hi, I'm Alan Unell. My wife Vokuhi and I publish a mostly daily healthcare advocacy newsletter to make sure our representatives know what they're supposed to be doing for us. And I met many of you up in Seattle.
Mindy Blasky, retired family medicine doc. I've been a member of PNHP Washington forever, it seems like.
David Loud. I have been associated with this chapter since its inception. I'm a retired healthcare worker, primarily active with Puget Sound Advocates for Retirement Action, and am on the steering committee of the Healthcare as a Human Right Labor Community Coalition.
I'm Marcia Stedman, and I primarily work with Healthcare for All Washington, been there for about 12 years. Also, I'm now the facilitator for one of the facilitators for the HUCS group that meets before and after each Universal Healthcare Commission meeting and their Finance Technical Advisory Committee meetings to kind of get a game plan going and to debrief what happened, what went well, what can we do next. And I'm also a member of PNHP National for a few years, I think. So I get all these wonderful resources like all of you do. So thank you.
I'm Hugh Foy, and I'm a retired general surgeon and currently on the board of PNHP Washington and PNHP National, and going to Chicago, yes.
Hey, hello, my name is Byron, a friend of Chuck's, and I've been concerned as a citizen for a very long time about these issues, and I'm kind of a fan of his work.
Greg Garver, retired neurologist over on the east side of the state in Wenatchee.
Hi, I'm Kay Lasker. I work with Healthcare for All Philadelphia and a bunch of other groups like the infrastructure banking and the public banking. And I think I want to look at it, have been looking at these things in terms of solving them, connecting the dots between similarity of the financing, the failure of our financing. And I think if we don't connect all these dots and understand the concepts, we're not going to solve any problems. So that's what I'm looking at and have been for many years.
Hi, I'm Diane Lucas. I'm a retired pediatrician in Portland, Oregon. I started with educating my medical school professors about single payer many years ago. I've been with Healthcare for All Colorado, Healthcare for All Oregon, and PNHP National, and now one payer states.
My name's Lynn Heidekoper. I live in Menlo Park, California, working on single payer for the last 23 years. A member of OPS, not at all happy that Gavin Newsom blocked our bill from advancing this year. It was a really good bill. And I think it's because he's running for president. He gets a lot of money from health insurance and the doctors who are anti-single payer. But I always loved to go to meetings all over the country. I was at PNHP Florida and other groups. I go to PNHP Connecticut. I'm a retired nurse, and I'm glad to be here. And I know Chuck really well.
Chuck was up here a couple of years ago and spent a month in my house, so I know all about him and when he showers and when he forgets to brush his teeth and everything else. Chuck, I think we all know, if not personally, at least know of him because he's got such a wide-ranging influence. Anyway, he's the founder and president of One Payer States Network. I'm not quite sure how old it is, what, 10 years old or so, Chuck?
15.
That's a pride, and OPS provides support and advice and, quote, radical solidarity for advocates working on single-payer healthcare, both on the state and the federal level. The SBUHCA Act, a terrible acronym, but SBUHCA is short to say, and it stands for State-Based Universal Healthcare Act, which is legislation that's now been introduced in both the Senate and the House, but it hasn't gone any further than that at this point in time. But it would allow states that are working on their universal health plans to get federal money that now goes to Medicaid and some of the other federal monies that go into the states, and the states could use that money on their universal plan, provided it provided certain guardrails that it was at least as good as the Affordable Care Act. Chuck now lives and works in the DC area and spends most of his time lobbying legislators and working with people across the country on OPS and the SBUHCA Act. A very distant past. He doesn't look like he's 85 years old, does he? He ran for, what was it, the state senate in Pennsylvania?
The U.S. Senate, back in 06.
06, ran for U.S. Senate, and he's been involved in lots of progressive organizations and taking a leading role in a lot of them, and was a professor of history and politics in Pennsylvania. After his presentation, we'll have some time for Q&A and discussion that Dana's going to lead. So take it away, Chuck.
Thanks so much, Dave, and the folks assembled tonight. Really grateful for your being here, and especially given the stressors, the anxieties related to this election, 20 days out. And I was asked to talk a little bit about how our healthcare justice narrative can elevate it, or how we can elevate it, given this election cycle. And I'm going to get into that a little bit more and actually just do a little bit of brainstorming with you and seeing what your thoughts are. But just to say right off the top that I bounce up to Pennsylvania, which is my home turf. I'm down here in Washington, D.C. It's not an easy trek. It's not inexpensive, but it's got to be done. And I am most familiar with Bucks County. For those of you who don't know, Bucks County is the swingiest county and congressional district in the swingiest state of Pennsylvania, and really Pennsylvania's ground zero. And it's a great opportunity knocking on doors to have the conversation and see what people think about, their health care. And, I keep it positive with regard to Vice President Harris, her recent statement that she wants to expand Medicare funding so that people can get home health care support in their elder years. That's a step forward after she took a significant step back right, from Bernie's bill, the Medicare for All bill in the Senate, that she had previously signed on to when she ran for president. How can we use these next few weeks to build toward, frankly, continuing our work during the lame duck session? This is what we do at One Pair States for the SBUHCA work group. I've got David Loud in the room. I'd love to hear some of his thoughts tonight as well. But that's the kind of work that we think about. We're always thinking 1 step, 2 steps, 3 steps, 5 years, 25 years, 50 years ahead. And that's where I'm going to lead this conversation ultimately to a conversation of what we call radical visioning. Great revolutionaries, great revolutionary and reform campaigns have never succeeded without having a clear vision. And it's not just a clear vision, but a strategy that's based on an understanding of what that vision, of what constituted that vision's success. So this is where I'm going to point in a few minutes. But what I'd like to do actually is to open up with a few stories. The announcement for tonight's event included a picture. I just want to bring this picture up because you wouldn't know what it means, but I'm going to just tell you that this picture that I found, Dave said, give me a picture that's sort of out of the ordinary. So I just grabbed this one, which is a little more out of the ordinary. This is this is the year that we founded One Pair States. This is 2009. This is December 9, 2009. And I'm pictured here with Jim Furlow to my right, who was our Senate sponsor of our single payer bill in Pennsylvania. We had the bill in the Senate and the House. This is now Harrisburg. And at this time, the House is majority Democrat, but the majority leader in the Democratic Party did everything he could to try to stop our single payer bill, tried to sabotage it at every turn. In fact, held a press conference making it like he wanted to draw attention away from our single payer hearing before the Democratic Chair Health Committee. But this hearing here is significant because it's the one and only Republican chaired single payer hearing, as far as I know, ever in this country. And we were able to pull this off through sheer persistence, radical persistence. I was told time and time again, you'll never get a meeting with, let alone a hearing from the chair of the committee. This is the story of Don White, Senator Don White from Indiana, Pennsylvania. Yeah, it's the Western County, 5 hours from Bucks County, where I was living and teaching at the time at the University of the Arts down in Philadelphia. And all the other lobbyists said, Don is tough as nails again. And I was able to get a couple meetings set up with him, but last minute they were canceled each time, right? It is at the legislative office right there in Harrisburg. And I approached her scheduler and I said, where can I be guaranteed a meeting with Don White? And she said, if you want a guaranteed meeting, you'll have to travel all the way across the state. So I took a day off of work, 5 hours, drove all the way out to Indiana, Pennsylvania. And the fact that I made that effort for just a 30-minute meeting, which was scheduled to just 30 minutes, really kind of knocked his socks off. He really was pretty blown away. Nothing like that had ever happened to him, he said. And that first 30 minutes, I was sitting down with him and his chief of staff, and the chief of staff was trying to kind of muddle the conversation. And then after 30 minutes, the chief of staff said, okay, your next meeting's coming up. And Don White said, a hospital in Wilmington, he wanted her to come back home. He wanted his granddaughter, he wanted his grandchildren and his daughter to come back home because it's tougher to practice in Pennsylvania than it is in Delaware because of the medical malpractice laws and cost of actually doing medicine. So he told me his healthcare story in private. And then I turned to him and I said, Don, the reason I've been persistent in coming after you is I see you very much, and I mean this in a flattering way, as many people saw Richard Nixon. Only Richard Nixon could go to China. Only Richard Nixon could go to the Soviet Union. You, as a retired insurance industry executive, you're the only person that could legitimately carry this bill, get this bill, a series of hearings, bring it up for a vote, and let's have it. And he said, at the end of the meeting, he said, I'll give you that hearing. I'll give you that first hearing and we'll see how it goes. Well, this hearing was, so to my right is Jim Furlow, Senator Jim Furlow. To my left is the nurses union president for PASNAP in the Philadelphia area. To her left is a Republican a doctor by the name of Dwight Michael, had his own independent practice in Gettysburg, was able to get Dwight convinced to come out for this hearing. Strong single payer supporter now. And then to Jim's right is Dave Stile, a Republican legislator and actually the strongest proponent of our single payer bill in the legislature. Dave Stile, Republican legislator from Bucks County. Got to know him. The work that we do has got to be built on relationships and not taking no for an answer and doing what people say can't be done, doing the impossible, right? I think Nelson Mandela, I'm going to paraphrase him, says that everything is impossible until it's accomplished, right? That's essentially my go-to way of thinking about this work. So we got that hearing. And most of the way through the hearing, Don White took a bathroom break and he approached me. At that point, I was in the back of the room. And he said, you folks just knocked it out of the park today. I want to take these hearings on the road. He said, we should do hearings on your single payer bill around the state of Pennsylvania. And so we had this agreement, this handshake agreement. The unfortunate thing is Don, as a friend within the medical industrial complex, was gotten to over the holidays by his friends. So by the time January swung around and I had a standing meeting with him and his chief of staff was the only one there. And the moment I walked into the office, he was looking at his watch and the secretary was coming back and saying, you have a meeting in 5 minutes, et cetera, et cetera. And so I knew that something was wrong. But the fact is that we got that hearing, we broke the ice, and we did something that no one thought was possible. So I just want to share that story with you. And then the second story I want to share has to do with my organizing graduate students at the University of Colorado Boulder. And when I arrived on campus in early 1989, I was appalled to find out that graduate students did not even have a standalone government. They had one seat on an undergraduate government. This is CU Boulder. And I put heads together with a couple of people and I said, we need to change this. So within a year, we were able to draw up a constitution and establish the United Government of Graduate Students at the University of Colorado. And more than that, we were able to earn benefits, healthcare benefits through negotiation. We threatened to unionize, but we got everything the administration wanted, that we asked of the administration. So we got everything we asked for all along the way. So we got healthcare benefits for working graduate students for the first time in the history of that university. That's really my most proud accomplishment in graduate school. So that's another campaign that people said will never happen. It did happen, and we won those benefits. We established a government. Third story, now toward the end of my career as a university professor, now at University of the Arts in Philadelphia. This is back in 2021. Beginning in 2018, and this is after a series of meetings with my faculty members, a number of them said, we need to unionize. We're not well represented on this campus, we need to unionize, but there was not a movement toward that. There was not a hard drive, but I brought union representatives on campus and we had the meetings, and there just wasn't enough enthusiasm. Fast forward, that was back in the early 2000s, and then go fast forward to 2018, and the environment was right for building a union, and put heads together with the AFT organizers who had built the union up at Temple University in North Philadelphia, and we started a quiet campaign. And if you know about union organizing, and some of you know, I do know, some of you do know, you start the quiet campaign. You have the quiet conversations with people behind closed doors, and you find out what it is that they want out of their job, what it is that they want to, what are their grievances, what is it that they would love to see a union do if we could get a union. Are you interested in a union? Would you support that? So you do a series of these conversations, and you build and you build and you build and you build. And after 2 years, we had built the capacity, or we had built the numbers to have the confidence that we could take the next step. So we had people sign union cards. Then we had a union election at the end of 2019, at the end of 2020, and it was an NLRB sanctioned vote, and we won 255 to 2. 255 to 2. And I'm telling you, every step along the way, everybody said, Chuck, this will never happen. We'll never get a union on this campus. I can't tell you how many people told me that again and again and again, but we won. My life was pretty miserable, actually, during that time period. I don't mind saying that when I was a graduate student, I ended up being hazed like hell from my professors, who, much as they pay lip service to progressive politics, they don't like progressive politics on campus. Now, at the end of my career, when I was organizing among full-time faculty, contingent faculty, we were contract faculty. So most of us did not have tenure. The fact is that I was dead man walking because the administration discovered what I was doing, and they began to make my life miserable, absolutely miserable. And they tried to drive me out, but I was under contract. But that contract, 7-year contract, expired the last semester following the passage of our union. But it was too late for the union to protect me. So I was fired. I have no regrets. And the fact is that we accomplished again something that people said could not be accomplished, right? Single payer hearing before a Republican chaired committee ain't going to happen. Organizing graduate students and getting health benefits at a very stingy university, a very politicized university, CU Boulder, ain't going to happen. It did happen. And then forming a union at a very conservative, actually. You think about the arts community. We had the most reactionary president imaginable, and we were able to accomplish that. So I just want to let you know that what drives me is a belief that anything is possible. And thinking about our theory of change, that's what brings us around to this conversation about SBUHCA, State-Based Universal Healthcare Act. I know we've talked about this in this circle before, so we won't get a lot into the weeds. Dave explained generally what the bill does. It's enabling legislation. It's a super waiver, and it will provide states that are moving and legislating and creating a legislative package to create a universal healthcare plan. It will allow them to access those federal healthcare dollars, with the exception of Indian healthcare and veterans benefits, because those communities don't want their benefits touched. And Medicare is going to be a challenge, but we can do this. And what really enhances this conversation is a meeting I had recently with Pramila Jayapal in Chicago. This is now the 2 days before the Democratic Convention. We were on the same panel together talking about healthcare, and I was invited there by Ellen Minsky, who is the executive director of Progressive Democrats for America, who also support the SBUHCA effort, support state-based single-payer campaigns. He said, I want you on a panel with Pramila Jayapal. I said, great. So I trekked my way out to Chicago, and we had 10 minutes back in the green room, and our conversation was as if we had been thinking the same thing in parallel, on the same track at the same time. Because what Pramila said, we need to unify, we need to coordinate the state campaigns and the national single-payer campaigns as much as possible. The introduction to the bills, our messaging around the bills, how we campaign on the bills, and we just need to sync up our efforts. And I said, wonderful, terrific. And since that time, I've connected with her new healthcare LA here and healthcare fellow. Serena Baserman is her new healthcare LA. So we're absolutely on the same page. And as co-chair of the Congressional Progressive Caucus, I'm reunited with Michael Darner, who, if you might know, he was on John Conyers' staff back in the day. And so it's really a marriage of work that bridges our state campaigns and our national campaigns. We've always fought for the national campaigns as one payer state. As Dave says, David Loud, that is our gold standard. That is our North Star. That's what we're all about, is getting to expanded and improved Medicare for all. The question is, how do we get there? That's what brings up the question then of visioning, radical visioning. And I want to spend just a few minutes and then open it up for questions, just to get people thinking, stretching your minds here, because I spent 45, 48 years sort of winning a lot of individual campaigns, helping to elect 4 U.S. senators, work for 4 U.S. senators and a U.S. House member, Ron Dellums. And in all that time, and also working on issue campaigns and winning a lot of them. We stopped the MX missile. I was part of I worked for SANE back in the 1980s, and we were effective in slowing and stopping American intervention in Central America. So much as we won individual campaigns, as you all know, we've been slipping backward. Neoliberalism has been creeping up on us, certainly since the late 60s, early 1970s. And now we're in a very precarious place. The Democrats enabled that. Unfortunately, the Republicans have pushed it. And now the Republicans are full on with fascism by bringing on the elements of white supremacy as well as religious nationalism. Those are the three cornerstones of fascism: state corporatism, white supremacy, religious nationalism, and all the other ideologies that spill out of that. I dropped a link for people who got on the call relatively early. I can do it later for you all, but I think it's an important document that I put together. It's a compilation of how people think about these things. And how does that relate to healthcare? Because it's the privatization, as you all know, as we're now moving into the period of Medicare selection, expanding your options, and the Medicare Advantage campaigns are in full throat right now. So it all connects. All of our issues can connect. Like Lynn Heidekoper said, the only way we're going to win, and this will come out very clearly when I go over this PowerPoint with you in a second, is we've got to connect people, we've got to connect our politics, and we've got to connect our policies. And that's exactly what I'm doing, what we're doing with Pramila Jayapal, is connecting the state and the national efforts. But it's more than that around healthcare. It's got to be also about all the other justice issues, because we're not big enough to win right now. We're only going to be big enough when we unite with people who are fighting for united basic income. And by the way, I've been rethinking this issue. Remember, Andrew Yang ran on universal basic income? If we guaranteed a basic income, think of the number of activists that we would have, the number of people who would have a baseline income, who could then rely on solidarity housing and become full-time activists. I think it's going to take somewhere in the neighborhood of 7 to 8% of the population mobilizing in order for us to get to what I call universal transformational justice, which of course wraps around healthcare. But it's we can't have an effective healthcare system unless we have a healthy society. And that means a strong democracy, that means housing, that means living wage, that means a clean environment, all the above, right? We've got to connect all these things. So let me pivot here for a few minutes and just talk about this strategy building to win 3.0. And this document, by the way, is the result of about 5 years of conversations when I've entirely revisited my own organizing ethos of the previous 45 years. I realized I was being entirely too tactical. So then I began to push myself and push one pair of states. And one pair of states is not just about healthcare justice. We're also committed to health justice, which connects up to the work that we do in the other organization I run, which is Justice for All Network. So let me do this. And I'm also going global. That's Byron Belitzos, who came in on the meeting. We're working on a global democracy campaign, which really builds on the earlier work of the World Federalists. So I think we need to be thinking globally. We need to be thinking nationally. We need to be thinking state. We need to be thinking regional. We need to be thinking local. I think we have to connect all of ourselves in all this work. Really, really critically important. So I'm going to share this document. Okay. And again, I'm always happy to spend time with people if you want to do a deep dive and actually really better understand what this can mean for your campaigns and how we can think about this. But this is designed for application for campaigns at all levels, all justice campaigns, the concept. So I don't have a lot of detail in here deliberately. It's an open-ended document that is editable. It's a PowerPoint. But I just want to get you thinking about what are the elements we need to be thinking about in order to win, in order to build a strategy that is going to win healthcare justice and health justice for all. So let me just go through this document. The first begins with this radical visioning. And what brought me into this conversation of radical visioning was the rediscovery of the reopening of a book that I read as a teenager. And some of you may be familiar with this. I may have mentioned it in this circle before, but the book is called Looking Backward by Edward Bellamy. And Edward Bellamy wrote this book about, it's a story about a character who goes to sleep in 1887 in dystopian Boston. And he's put to sleep. He has real sleep issues. He's put to sleep and basically in a tomb under a house. And he's woken up in the year 2000, 112, 113 years later. And when he wakes up, he finds himself in utopian Boston. And the entire story is based on, how did I get here? And what happened from the time I was living in Boston 113 years ago to get us to where we are today. And so that's what the book is. It's a conversation that unpacks this radical vision. So the first thing we need to do is radically vision a utopian society where justice for all is, in fact, the case. Global justice for all. Everybody has what they need. We care for each other. We care for the planet. And that's the sort of visioning that is critically important, in my view, to get us anywhere near that. So radically visioning is the first step. The second step here is actually asking ourselves, through the process of reverse engineering, the winning strategy, the strategy-driven tactics that will drive our success. What happened to get us to this point? And that's the conversation that we have in this book, Looking Backward. It's really a very clever book, the way that it helps really get you to think about strategy. So the next one is, and many of you done this, probably all of you have done this, have done some sort of a SWOT analysis, right? And now analyzing your organization and your campaign's strengths, weaknesses, opportunities, and threats. And you need to have an honest discussion about what it is that you face. And the document here is going to go more into detail on this, but it's very important. And basically what we can say is that we learned and applied the maxim: best and self-other assessments derived from objective and honest methodologies and sound and verifiable research. So this has to be really well thought out, this sort of SWOT analysis. The next step is, or the next three steps are joined by the 3 J's and the 3 P's. This is joining justice-centered people, justice-centered politics, and justice-centered policies. So similar to what Lynn said, we need to focus on connecting the people, the politics, and the policies. So we're joining and connecting the J's and the P's, pointed to universal transformational justice for all. And breaking it down, number 5 of the 7 is building deep relationships. I think it was it Sherry who was mentioning this at the top, that it's really about building deep relationships, meaningful relationships that will produce trust and respect and hope and empathy and love. And that's not easy work. For those of you who know Mike Huntington, Bernie's only got, 15 supporters in the Senate. So I'm dealing with the reality. And the reality also is we're winning over a few Republicans at this point. We've got a verbal commitment from a member who's prepared to co-introduce our SBUHCA bill in the next Congress. So I'm going to leave the name out right now because I don't want to, make it an awkward situation. But that's the kind of work that we're doing, is really being mindful of who our audience is and adjusting our language in a way that makes it more palatable. So in any case, just practical language use is very important. Internal dialogue is also very important. It must be respectful, clear, validating, and uplifting. How many times have we had a sort of assumptions that so-and-so was going to do something and and they didn't do it because nobody reminded them, we didn't have the conversation, we didn't spell it out. Just to be clear, that it's important that we be clear that we're precise in the way that we communicate among and between ourselves. I mean, right now we're having a conversation within one pair of states is how we clean up our newsletter, because the person who's been pushing it out has up to now failed to put the big donate button in the middle. So what we need to do is create an editing committee so that there are a few people who are looking at the newsletter and other communication so that we're clear about what it is we're doing, what are our objectives, what are our goals, and how are we pursuing that. So external communication, internal communication are equally important. I'll finish this quickly, David. Identify, define, and or call out or call in our supporters and non-supporters. We learn to deal most effectively with and these words are somewhat triggering. We learn to deal most effectively with our enemies, opponents, rivals, adversaries, competitors, and would-be and should-be allies. Important to understand who we're dealing with. And that doesn't mean that we're vilifying people, but it means that we're accurately defining who it is that we're dealing with, what it is that we need to say, how we can neutralize them. When we did that single-payer hearing back in 2009, I was personally able to neutralize the Chamber of Commerce. How? By meeting with the executive director of the State Chamber of Commerce and his lawyer. I said, give me a meeting. I want you to know that this is really pro-business. What single payer is pro-business. This is something, and he was convinced, but he said, I can't support it because we don't have consensus, but they were on the sidelines. They didn't lobby against our bill. That's the Chamber of Commerce. Organizational assessment, again, similar to the SWOT analysis up above, it's important to be honest about your organization, where you are and what you need to do to improve who you are and what you're doing. What did we look like? How did we work? How did we staff? How did we raise resources and that kind of thing? We figured all that out, ultimately. We figured out the decision-making process, got a lot better. Ideally, it's bottom up, right? But sometimes under urgent circumstances, you need a war room and you have to do top down, but most of the time it's hybridized, work level or work group decision making, but really being mindful of how you make decisions and who's making those decisions. Development, which is fundraising, in-kind resources, volunteers, distribution, delegation, and management. We figure that stuff out without getting into the weeds. That's the kind of stuff that you really do also need to be mindful of. Number 14, and this is really important as well. We have to create timelines where we have short-term, mid-term, and long-term successes. This is one of the reasons that we're fighting for SBUHCA also, is that we can message it in a way that's going to get us to 218 votes in the U.S. House, 51 votes in the Senate, and get the president to sign it. Because we're going to message it in a way that's going to appeal to the way that those members think about this legislation. But that's a short-term or mid-term goal that's going to get us to Medicare for all, improved and expanded Medicare for all. It's going to sustain us. It's going to give us a jumping point for the next level of campaign. Number 15, again, very mindful of measuring, quantifying, qualifying our goals, being clear about what our goals are, defining them in terms of what, when, who, how, and why. And then I think this is the last one. Yeah, number 16, which is bringing it all together. How did we win? How did we win? Well, the way we won was in the streets, in the suites, offline and online, in rural, suburban, exurban, and urban America, and in all of our capitals, local, county, state, national, and international. So that's what it looked like, and that's how we won. That's how we won not only healthcare justice for all in the next 5 to 6 years. That's how we see that. Not only did we won universal justice in America within the next 25 years, and then in the next 50 years, we win that global justice for all. It's a tall order, but it can be done. But it requires planning, and it requires intentional strategic thinking and planning along the way. And frankly, I really, really want this to happen in all of our social justice movements. And I'm happy to share this. It's an open access document. And this is the kind of thinking it's the kind of thinking that won the day, right? It's the kind of thinking that won what it is that we all want, what it is that we need for our posterity, for our children, our grandchildren, and our great-grandchildren. So I'll stop there, take questions. Thank you so much.
Well, thank you, Chuck, for a very comprehensive presentation on strategizing. On our question and answer period, so use the handheld function down at the bottom of your screen, and then I will call on people in the order that they raise their hand. Okay, well, I'll start it off. We have to learn how to connect people to politics.
Right.
And that is a big problem that we've been facing for, I don't know how many years, for forever in my lifetime. So what kind of strategies would you suggest that we can do to connect people to politics and help people see what they need to see?
Well, in part, it's in the document, which is meeting people where they are and being very intentional in listening, who's the leader of the Universal Healthcare Campaign in Washington State? A Native American leader. Help me out, David.
Oh, Vicky Lowe?
Vicky Lowe, right. So I
Head
love
of the Universal Healthcare Commission.
Universal Healthcare Commission, right. I mean, she came in on our first intergenerational summit, Dana, and she said very simply, she said, now, Vicky, this is her grandmother. She's relating a story she's hearing from her grandma. Now, Vicky, and you've all heard this probably in one way or form or another, but you were given 2 ears and one mouth for a reason. We need to be listening at least twice as much as we're talking. And I think we all have a habit, and I'll own that, of talking too much. We have to be very intentional in listening, and that's why I'm canvassing every weekend up in Pennsylvania. And my history goes way back. My first organizing campaign was the Nuclear Safety Initiative in California, Proposition 15. This is in 1973, 74. And that's what I did when I was 13. I knocked on doors and listened to people. And we got crushed in that campaign because we were the oil industry, the petro industry owned that nuclear power at the time. But the point is that I really learned very early on that it's that personal contact, Dana. We've got to meet people where they are, and we have to make that extra effort to understand their concerns. And then suddenly the conversation opens up, and then the politics doesn't feel so alien. Drew Weston wrote a book called The Political Brain. Some of you may be familiar with it. He's a neurologist at Emory University, and he was an advisor to Barack Obama for about 15 minutes until he wrote a critical op-ed in the New York Times, and then he was fired. But Drew Weston he has done, I think, some of the best work understanding the problem with politics and people's brains, which is that the vast majority of people, where politics are concerned, people go to the lizard side of their brain. They go to the right side of their brain, and they drop any sort of creative impulse. So when I was dealing with academics for 32 years, this was the case with my own academic colleagues. When it came to politics, they went to that emotional response, that trigger response, and I think that's often the case. And unfortunately, that's the conditioning that we get through our K through 12 education system, through the corporate media that gets us thinking negatively about politics. And, Congress right now has completely forfeited its legislative function. The courts are now legislating for the country. I mean, so people have come to think of politics as a negative thing. And that's why any number of people, consciously or otherwise, are leaning toward authoritarianism, because they want somebody to come riding to the rescue, right? So how do we restore that hope? It's the interpersonal. It really does start with the interpersonal relationships. At the same time, we have to roll back Citizens United. We have to create, public financing of elections. We have to get back to the basics. The founders of this country did not seek politics as a career path. They saw it as a public service. And that's the kind of ethos, those are the kind of values that we've got to restore, and we have to model it ourselves, which is why I ran for Senate back in 2006. I started that run in 2004, but it was out of that campaign that we created a statewide movement that had not previously existed in Pennsylvania. So I think we all have our own part in this, but it really begins fundamentally with listening and caring and sharing. I hope that's a good start to an answer, Dana. There's a lot more to it, I would add, but I don't want to steal other people. Yeah.
Okay. David Lau.
Thanks, Chuck. As always, you do a tremendous job of covering a lot of ground in a fairly short time. And I want to just say, so everybody will know this, that the State-Based Universal Healthcare Act had first been introduced by Jim McDermott in 2015. And for years, we tried unsuccessfully to get a Senate companion bill. And we did not succeed in that until Chuck decided to move to DC and set up a lobbying operation, which was, largely him single-handedly. And so we owe you a great thanks, Chuck, for your commitment and your determination and your success in getting a Senate companion bill for the first time quite recently. My question is, when you talked to Pramila in Chicago, did you get far enough into the conversation to know what the timing might be that she has in mind in the event that we do well with the elections, to bring the state-based folks and the Medicare for All folks together to strategize joint campaign? Did you get a sense of timing on that?
No, I'm waiting. Actually, I communicate with Serena by email every week. She said it's coming. It's coming. That strategy meeting is coming. I mentioned earlier Michael Darner, who was with John Conyers. He's the executive director of the Congressional Progressive Caucus. He's going to be in that meeting. All of the leadership, staff leadership, the staff of the leadership is going to be in that strategy meeting, and some of the members are going to be there, as I understand. So we're going to have a half day, as I understand it, strategy meeting where we're actually going to talk about what this looks like or what this can look like. Does that?
Following the election, no doubt.
No. Actually, no. Well, it may be after the election, but when I met with Serena and back, oh gosh, it's now, I guess, been about 5 weeks, I think 5-6 weeks. She said, we really want to do this in October. So here we are, we're in mid-October. So I'm still hopeful it's going to happen before the election, but no guarantees.
Okay, thank you.
But I will stay with it. Trust me. Yeah.
Chuck, as you organize around the country, where or what state has made the most progress towards a more equitable, universal healthcare program? And what do you see are other accessory challenges or issues other than just merely universal health insurance that need to be addressed to get real health care, justice, and equity?
So the first part of your question is where the states rank, like who's done the most, and then the policy question about some of
the policy question, just beyond just having universal health insurance. I mean, you can have all the insurance in the world, but if you don't have a delivery system that is organized and forward-looking, you're still going to have problems. I mean, that's where we are right now. You know, you might have the best health insurance in the world, but it's a 3-month wait to see a specialist in most urban communities.
Right. I think there were a multiplicity of challenges, policy challenges there. Well, let me start with the first answer, which is partly going to answer or provide for the second one, which is Oregon. Your friends to the south are further along from what I can see than any other, and they've now formed and are meeting a governance board to actually put the program together, which is both the finance and the delivery pieces. So whatever thoughts you all have here, concerns that you have, and I mean, I could just rip off a few different things, but you know, I know that they're open to suggestions and ideas. One of the people who has done a lot of border crossing, Warren George, out of Corvallis. I mean, Warren has been in any number of the meetings, the Washington State meetings, the universal healthcare meetings, as well as the work in Oregon. He's either leaving that governance board because he realizes that his own economic expertise, which is leaning a little bit into the answer in the second part of the question, the economics, is he feels like he'll have more influence actually being outside. And the reason being is that in Oregon, and this is a structural problem, and this is something that's probably coming down the pike with you all in Washington State, is that the state political leaders they're not looking to the board to provide the economic expertise. They're bringing in consultants and they're bringing in existing bureaucratic staff. so that Warren made the assessment, and I don't think I'm speaking out of turn when I say this, made the determination that his ideas on economics, which is where he's centered almost all the time, is not going to be taken seriously, or it's not going to be admitted. It's not going to be part of his role. So he's actually going to be working on the project from the outside. So that's actually one of the big challenges, is how do you fund it, right? And the funding is going to be a whole lot easier if you're able to capture those federal healthcare dollars as provided through the state-based universal healthcare legislation. That's one of the big pieces, because politically, to actually have to ask your state residents to pay more, and you don't have a state income tax in Washington, right? So
Right.
going to take a lot of creative funding mechanisms. And I know that people are playing around with a variety of different ideas, and I'm not in the weeds on that, but that's a big part of it. You know, people have become so antagonistic toward taxes. A big challenge is getting people to understand that there's a trade-off here. You know, no longer we be having to pay premiums and copays and deductibles. That's gone. And no longer we be having to pay excessive, I don't know, you have property taxes, right, for schools, that kind of thing.
Yeah.
But embedded in your property taxes, you all probably know this, right, is the cost of healthcare for your school staff, right? That people don't know that. People don't think about that. Auto insurance costs embedded there are the costs associated with healthcare, you know, people who are damaged in accidents and so forth. And then for businesses, the cost for this is the hours late. What's the cost that we have to pay, businesses have to pay for
Labor and industry.
What is it?
Labor and industry costs.
There's a term for it. It's a tax.
Compensation. Workman's compensation.
Yeah, workers' comp. There you go. There you go. Yeah. That's one of the. But these are hidden taxes, and people don't realize that those numbers are going to come down, and people's pockets are going to be fuller as a result of these taxes being curtailed, if you will, or eliminated altogether once you have a universal healthcare system. So I think the funding part of it and really explaining what that's about is really a big part. And then, of course, facing the power of the medical industrial complex. They're going to throw everything they can at any campaign to try to succeed, whether it's bulk purchasing of pharmaceuticals or what have you. But in terms of the policy piece, yeah, I think the budgeting piece. I think there's the way that Steve Kemble, who's the chair of our policy committee, he explains it, that it's not all one size fits all, that for a lot of healthcare, fee for service does make sense. For a lot of healthcare, global budgeting makes sense. So creating a hybridized form or system for actually funding healthcare is a real challenge here, I think. So I hope that helps answer your question.
You know, you said you work for Ron Dellums. And as I've been researching and looking around to see who had the rider for a U.S. Health Service Corps on previous healthcare reform bills.
Right.
And I finally have reference to Ron Dellums, who evidently had that rider for, you know, loan forgiveness in exchange for service like the military. Do you know anything about that?
So like a national service program?
Yeah.
I don't. I do remember that Gary Hart ran on that in the 80s. I don't recall. I was a military caseworker for Ron when I was an undergraduate. I was so I was advocating for members of the military, mostly, you know, black and brown soldiers who were getting screwed over in the military, because once you sign up with Uncle Sam, you lose your constitutional rights. I vaguely remember that, but let's exchange ideas here if you want to carry the conversation. And then, of course, Barbara Lee, I've gotten to know her a lot more recently, and that she's losing her seat because she ran into the Senate primary. And if Harris is elected, you know, she's Harris's mentor. Many of you may know that, right? Barbara Lee is a great champion, and the only vote against the war in Afghanistan, and of course the voice of conscience in Congress. the heir to what Ron Dellums was doing. So I'm in conversation with Barbara Lee, and I wonder if she carried some bill or carried that bill into the future as well. See if you can check that out. Look and see if Barbara
Okay.
Lee carried that national service bill.
All right.
Thank
Thanks.
you. Thanks, Hoy. Or Hugh Foy, not Hoy. Hugh
Yeah.
Foy. Lynn?
Otherwise, Jane. Okay. Yeah, Lynn, you're next.
Thanks. Just to follow up what you just said, I worked on Barbara Lee's campaign, and she was not well known in Southern California, and AIPAC gave millions to Adam Schiff, and that's why he ended up winning. And she was along with Diane Watson, the first legislator to author single-payer healthcare in California. A lot of people don't know that. Senate Bill 2123, and I was involved back then and gave meetings, hearings about that. But I think Pete Wilson was Republican, was the governor, so it didn't go very far. I believe I read somewhere, and I wished I'd saved the document, and it was Pramila and on what she was going to do for healthcare in 2025. And my understanding was that she and Bernie are not going to push for single payer in 2025. They're going to more go for the benefits, hearing, vision, dental, in Medicare. Now, Kamala has come up with, is it lowering the age of Medicare and then, home health, that they were going to cover home health.
Right.
So, and I didn't realize, I didn't really follow Kamala when she was a senator, but like Chuck was saying, she was a co-author of Bernie's bill. So I didn't know that. So that's why Trump calls her, communist and all that ridiculous stuff. Yeah. Well, actually, no, Chuck and I, he has posted about the fascism, and I don't know if you're interested, but there are two very important movies that are out that will make you understand what's happening with the Christian nationalists and stuff. One is Vigilantes, Inc., about this Ku Klux Klan and how the minority vote is suppressed, and the God and Country. Your jaw will drop. So I was going to put the links in for that.
Sure.
But I know that there are people, and I don't say Alan Minsky, working on the Project 2025's effect on healthcare. I know Chuck mentioned a little bit of that. Do you have any more information about that and how they're going to affect healthcare?
They're gonna push the privatization scheme. I mean, that's embedded in Project 2025. They're gonna roll back Social Security benefits, Medicare, Medicaid, yeah, all the above. They're all about industry and privatization. That's what the Heritage Foundation's doing. Yeah, but yeah. So thank you so much, Lynn. Appreciate it.
Something a little bit different. I really liked what you said a long time ago about getting on other types of organizations, email blast lists or listservs to see what's concerning them and, how we might work together and come to them with we can help you, and presumably sometime later on after we've helped them, they'll help us. Is there kind of a list of a bunch of different types of organizations out there that we might want to get on their email lists? Or, I could think of 6 or 8 around Seattle that, like the Rotarians or something like that. But is there a list out there that somebody has put together that would make it, jump started?
Social justice organizations or I mean community organizations, because go ahead.
Community organizations that we'd like to bring in eventually to what we'd want to do with healthcare justice.
Right. I mean, I could brainstorm stuff with you. We had 82 organizations co-sponsoring the SBUHCA petition. We can start with that. So these are people who are not necessarily all in with national single payer, but they see it as a pathway, and so they want to support that. Like Doctors for America, I think they were created in part to support the Affordable Care Act.
Right.
So organizations like that are important for winning this step, this next stage of this campaign. We have to bring more organizations in. And once they see that success, then they're on board, I believe, because we've built that relationship and we've had that success. And now so many Americans are convinced that things are not possible. This is the reverse of what John Kennedy embedded in our thinking, that we have to vision. He created a vision for the country. Within a decade, we're going to get to the moon. And most people thought that was poppycock. That was not possible. And of course, we did. And so we need to think in terms of moonshot programs, that we can actually get accomplished, and actually visioning. But as far as connecting with other organizations, the Poor People's Campaign, I think, is I think we need to get to people who are uninsured, underinsured, people who are really suffering, for lack of housing, who are in areas that are environmentally damaged. So a good friend of mine is encouraging me to do some outreach in East Palestine. East Palestine was where that rail car, those rail cars flipped in eastern Ohio. That rail line ran right past where I was living in Wilkinsburg near that same time. And it's those communities that are really desperate and are eager to connect and find some hope in an otherwise crisis, miserable circumstance. So just creative thinking, I think, and people are willing to listen. The vast majority of people do support Medicare for all, but it's just not on their priority list. But once you express concern, and I want to make it clear that you don't have to do the work, all the work, involved with the housing for all, but showing up and helping at critical moments, that's what's going to tip the balance sheet, is being there at critical moments. When Boeing workers are going on strike, show up at the picket lines, right, David? Show up, show that solidarity. That goes a long way in terms of people's memory, and they'll say, you were with us in that critical moment. It's immensely important to show up for people.
Pramila did that.
What's that?
Pramila did that.
There you go.
She was on yeah.
Really, yeah. So think about that kind of stuff rather than, I mean, I have to push myself, but that's what's required of building a winning strategy, is doing things that you're not used to. That it's exhausting to travel up to Pennsylvania every weekend. Trust me. And I'm living on a Social Security check and a small pension check. And I'm asking people just to help me a little bit. It goes a long way. Just chip in whatever you can with one pair of states if you have any capacity. I'm not ashamed to ask for it, because I know, and you'll know, that it's going to be used. I'm not paid for doing the work I do, but it needs to be done. And every little bit really matters. So if you're on the fence about doing something, do it. I hope that helps, David. Take a look at the 82 organizations that are supporting our SBUHCA legislation. That might be a good place to start. Otherwise, there are civil rights organizations that should be natural fits for the work that we're doing. Women's, reproductive rights, that's embedded in our legislation now, right? Reproductive rights is embedded in the SBUHCA legislation.
Planned Parenthood, places like that.
Yeah, but thanks for the question.
Can you say something more about that SBUHCA bill?
Sure. I don't know if you want to wrap the meeting soon or how much time we have, David? I'm okay to go for 5 more minutes if you want.
Sure.
I think.
I mean, I want to be mindful of, a few of us are.
Well, we're all here on the West Coast, and I wouldn't say, I can't say all, but most of us, so. You're the one who, it's 11:30 at night or something like that.
Yeah. I'm used to burning the candle on both ends. And by the way, for those of you who know Joel Siegel, I just visited him down in Charlotte. He's right now he's hospital ridden, not doing well. We're almost the exact same age. I just want you to throw some good thoughts his direction. If you're a prayerful person or however you send good vibes, just keep him in your thoughts. Joel Siegel was John Conyers, senior legislative aide, wrote the 676 bill, had a strong hand in running the ACA bill. Just want to give a shout out to Joel. He's on my mind every day. I want to cry.
I knew Joe Siegel and he knew me, and I'd heard that he was ill. Do you have any way to send him a card or something?
I'll give you, he's taking phone calls. So if folks want to, I'll drop my email in the chat here. If anybody wants to reach out for anything, and David, I'll send you the PowerPoint for the strategy building.
Yeah.
Feel free to share that with
Great.
group's members here, anybody else, and anybody who wants to have a conversation about that. And what does it mean to you, and how would you think of it, define it? But Mindy, can you repeat your question?
Yeah.
I just haven't heard about that SBUHCA bill. If you could just make some quick comments about what it is.
Right. Okay. David, do you want to take that? You're as well versed as I am. You'll save my voice. David Loud.
Oh, all right. It is a bill, Mindy, that would have first of all, it's an amendment to the Affordable Care Act. It adds a new section to the Affordable Care Act that would enable states to get waivers from the feds, number one, to integrate into their state funding the federal healthcare dollars, as Chuck has explained, accepting the VA and the Indian Health Service and a couple other things. It would give the state control over those federal healthcare dollars so they could use them to build the universal state plan, number one. Number two, it would provide a waiver to exempt the state from the ERISA bill, the Employee Retirement Income Security Act of, I think, 1976, which, in a nutshell, enables self-insured employers that is the health plans of self-insured employers, and most of the big companies, most of the big corporations now are self-insured for healthcare benefits for the employees. And the ERISA bill allows that self-insured employers do not have to observe or be subject to any state benefit mandates. So if there were a universal state plan and the employer said, we don't want to have anything to do with that, they can fall back on ERISA and say, we're out of it. And in fact, in Washington State, in 1994, was it, when the Washington Health Plan was adopted, which was sort of the precursor to the Affordable Care Act that Governor Lowry managed to get. Wait, was he governor at the time?
Yes.
Yes, Governor Lowry was able, with a whole lot of help and support, to get the state plan adopted. And it was repealed in 1995 after the 1994 elections, where Republicans kind of did a sweep around the country, and they repealed it. But one of the biggest flaws in the state's plan was that most of the employers said, count us out. Us and our employees won't have anything to do with this state plan. So anyway, the state-based Universal Healthcare Act would provide federal funding of existing healthcare dollars, federal healthcare dollars, and it would protect the state plan against being overturned on an ERISA basis by self-insured employers. And there's a lot of other things about it. In fact, Mindy, I'm actually surprised that you're not more familiar with it. I want to make sure you're on the right mailing list. So anyway, I hope that helps. And by the way, I think Chuck referred to this. One of the things that the current version of the SBUHCA bill would do, it would allow 2 or more states to create regional plans. And so, there's been a lot of interest on the West Coast in the possibility that as this thing develops, that Washington, Oregon, California, and possibly other states on or near the West Coast that are going in the same direction might team up and do something powerful. But the whole theory of it is that this is a step toward a national plan, that states will lead the way, as has happened so often in our country's history with Social Security and women's suffrage and marriage equality and abolition of slavery and child labor and so on, that things first get established at the state level where there's more political power to turn the tide on the issue. And then that changes the political dynamic in Congress. So does that help?
Yeah, I mean, was that what the problem was with the Vermont single payer? That they didn't have the ERISA waiver?
No, it was a little more complicated than that. And it had to do with 2 things. One, problems with how to fund the state plan, and the political problem that the governor backed out in the last hour and decided to scuttle the whole thing.
I see. Okay. Well, thanks, David. Thank you.
He let it go way too long. It was towards 4 or 5 years downstream. If he would have acted immediately, he could have gotten, but he delayed.
Right.
Sorry.
Who delayed? The governor?
Oh, the governor of Vermont.
Shumlin, Governor Shumlin. Yeah, I think he got like 49% of the election, and the election was thrown to the legislature, and so he lost a lot of political capital at the same time to reassure his getting back into the governor's mansion. And one of the things he sacrificed was the single payer bill.
Oh, great.
And Vermont's also problematic, and it's a very small population, 600,000. Funding it would have been really difficult. And I think they failed to make an effort even to capture the federal healthcare dollars, which is what SBUHCA is trying to do.
And by the way, there's an important thing that we can accomplish in the 2025 legislature in Olympia, which is that Senator Hasegawa is going to reintroduce his Senate Joint Memorial, which passed the Senate and didn't pass the House last year. And what that memorial does, it's 2 parts. The first part is to the congressional delegation and to the national administration, the White House and so forth, saying we need a universal health plan. We need a single payer bill in our country. And if you can't do that, support the states who are trying to establish universal plans. And so it's a sort of a companion piece to the SBUHCA bill. And I think if we do our work well, we can get that passed, and that'll be a real strong message to the country and to the Congress that we're serious about this and are gaining strength.
Right. And similarly, in Oregon, in the 2022 election, they adopted a constitutional amendment that declared healthcare as a human right. Many of you probably know that. And that's also provided some juice to what's happening down there. And I did drop in the chat, Mindy, and for others, the language of the bill and a brief explanation for the State-Based Universal Healthcare Act. The first is Ro Khanna's bill, and the second one is Ed Markey's bill. But it's the same language. But everything's in the chat there, my contact information. Follow up with me if you have any questions. This is very exciting legislation, and Pramila she refers to it as her bill. I've heard her say this many times, because she wrote most of the existing bill. It tweaked a little bit, like David said, giving states the ability to collect themselves in regional compacts, and they don't even have to be contiguous. If they want to do bulk purchasing, it could be states scattered across the country coming together to do bulk purchasing of pharmaceuticals or medical equipment. And also keep in mind, most of you, I'm sure you all know this, is that Canada, how did they get to national Medicare for all? It was adopted initially in Saskatchewan. I realize that 1960s is not the same as today, but that same modeling of state innovation leading to a national answer is really part of our history and our constitutional framework.
And let me just add, Chuck, that Senator Markey, in introducing the Senate bill, was very explicit that this is the way we're going to get to Medicare for all. That was his thought. That was his pitch when he introduced the bill.
Right.
Okay, we have maybe time for one short answer from a question from Lynn.
Real quick
I
one.
put in the chat the document I was talking about. It's the Progressive Caucus's Agenda for 2025. It was done in April, and of course Pramila is the chair of that. And if you scroll through, there's a section on what they're going to do to increase coverage in healthcare.
Thank you. Okay, I'll pass it off to Sherry for parting words.
Yes, I think we're all ready to say goodnight. But before we do so, let us all remember Tommy Douglas, who won a poll in Canada in 2004 as the most famous Canadian ever. So who was Tommy Douglas? Well, I think many of you know he was the socialist premier of Saskatchewan who put in place the coverage for hospital care in Saskatchewan in 1947. So let's hear it for Tommy Douglas, and let's say goodnight.
And by the way,
And for Chuck
Sherry,
Pennacchio.
not just the most famous, the most admired. That was the polling question.
All right, okay.
Oh, I nominate Chuck Pennacchio for the honors.
Thank you so much.
Tommy Douglas Award for the United States, yes.
Yeah, I'll second that nomination. That was a really, really inspiring presentation. Thank you.
Yes,
Yeah.
thank you so much.
Thanks, Chuck.
Absolutely. I'll come out and visit soon again. Love you, Mo.
Now's the time to finally realize we the people must make some choices. If we want single-payer health care, now's the time to raise our voices till they hear us in the halls of Congress and behind the White House door that we're sick and tired of getting sold out and won't take it anymore.
Find out why Physicians for a National Health Program believe America must put people before profit and offer all Americans America's best and most affordable health care plan. Improved Medicare for all.
Let them hear us. Medicare for all, because healthcare is a right. Medicare for all, and the U.S. all the light. That the best healthcare plan is a single-payer plan. Now's the time to finally put it on the table.
Keep the pressure on toward improved Medicare for all.